Come in. Hey, are you Miss Hernandez? Yeah, do you care to tell me your name and date of birth? Imelda Hernandez, 11/24/1958. Thank you very much. All right, so I just wanted to come in and see if we get you a little more comfortable. I was going to give you some pain medicine before we get started on this dressing change. Would that be okay with you? Yeah? How is your pain on your butt right now, since that's where your wound is? About a 3? Okay. Well, we'll give you some medicine beforehand so that we don't cause you too much pain during the procedure. Okay? Right. I'm going to go grab that and get that ready, and wash my hand and put on some gloves here. I'm Miranda. It's me. I'm back. Yeah? How's your pain doing? About a 2? Okay. Do you feel like we can go ahead and do your dressing change? Okay. All right. You tell me your name and date of birth again. Let me look at that bracelet. All right. Perfect. Okay. So you're in the perfect position, so I'm not going to have you to move at all. Okay. You're perfect there. So I'm going to go ahead and uncover you. Do you get cold? You don't? Okay. All right. So I'll uncover you and leave your bottom covered as much as I can. I'm going to go ahead and take that old dressing off. I do have some students outside the room. Do you care if I let them come in and assist me and watch? You don't mind? Perfect. Thank you very much. All right. So I'm going to talk with them through it as I'm doing things so they know and can learn. Is that okay? All right. Now, if during this procedure you have questions, you please make sure you speak up and let me know. If you experience any pain or discomfort, let me know what I'm doing, and we'll see what we can do to help make it better. Okay? All right. Thank you. All right. So the first thing I'm going to do is I'm going to grab just a waterproof drape and kind of put under your butt. And then I did grab a red bag. I also have a red trash can in the room where I can just put my old dressing onto my chuck and throw it in that location as well. So I've washed my hands. I've got on my clean gloves. The next thing I'm going to do is just lightly release this tape. I'm going to be real careful, okay, so I don't pull your skin. We used paper tape, so that makes it a lot easier. Comes off a little better. Okay. And then I looked to see what was documented about exactly what they used inside of your wound here. And it looks like that they just used one of the long gauze sponges. So you just have one long sponge in there that I'm going to pull out real gently, okay? So, guys, if this was multiple 4x4s, it should have been documented exactly how many was used. And so as I was taking them out, I would want to count to make sure that how many I removed matched what was documented was placed in there. So this is just a big long gauze, and it come out very easily. It's still a little moist. So I'm just going to take a look at the wound and note that I do have some tunneling and some what looks like undermining. Got some bone showing. And then I'm going to go ahead and dispose of this. I'm going to go ahead and change my gloves as well. And we'll work on setting up a field so that we can irrigate Miss Hernandez, her wound. We're going to put on some new clean gloves and you're doing okay, Miss Hernandez? Yeah. All right. All right, I'm just going to set up some of my stuff, and it has to stay sterile, which means I can't leave it or let anything touch it, okay? That way we don't add any bacteria or anything to your wound. So I just brought some stuff in with me. I have a dressing change kit that has most of the things I need. I am going to add some additional things. I'm going to add some cotton tip applicators. I do have the contents of what I have on my tray, and it didn't have these, and I do need a couple. I'm adding a irrigation syringe. So you may need anywhere between a 20 and 60 ml syringe, just depending on the size of your wound and how much irrigation you need. I knew from changing this dressing before that it didn't need irrigated a lot. So I just got a 20 ml syringe. I did grab a couple extra 4x4s, just because you can never have too many, and I would rather have more extra than be short when I get in there. I did grab a couple of rolls of tape. I'm going to stick these in my pocket. I do just like to bring them in case something happens and I need them, and the tape that's in my kit maybe rolls off my sterile field since it is round. I did bring a couple of chucks, so these water resistant drapes. The first thing I'm going to do is just go ahead and I'm going to place this under Miss Hernandez's bottom here to the side, so she's in a nice sideline position. So when I go to irrigate the wound, that's all going to drain down onto my drape that has that water resistant barrier on the other side. Doing okay? All right. The other thing that I brought was a wound culture swab. So if I had an order for this, I would want to bring this with me. I do need to make sure that I've irrigated the wound properly before I ever swab it. You don't want just old drainage and things sitting there and then swabbing that. So we want to make sure it's the actual wound bed that's nice and clean before we swab it. I don't have a wound culture ordered, so I'm just going to set this to the side. I just wanted to show you guys about this. So I'm just going to set that on the end of her bed. I did bring a red bag, as I mentioned. I did have one that I grabbed. What I will probably do is just dispose of everything on my chuck and then take it to my red container afterwards. The other thing I brought is I brought a new bottle of 0.9% sodium chloride, just in case I needed extra for irrigation or saturating my 4x4s. My kit does contain a small bottle of 0.9% sodium chloride, and that is my order for irrigation, is that same fluid. And so I think that I will have enough. But I just bring this as a precaution. Okay, so the first thing I'm going to do is kind of just sit everything out of the way so that I can set up my sterile field. All right, so I've got on my clean gloves, got my sleeves pulled up nice and good. I'm going to go ahead and open my kit. So my kit has little arrows and it says peel here. So I'm going to start by peeling away from me and set that to the side. My kit does have a couple pair of sterile gloves positioned there. And so I'm going to go ahead and just remove those because I'm going to put those on later and I can take those out without contaminating anything else. So I'm just going to put those to the side with the rest of my stuff. The next thing I need to do is I need to remove my sterile drape. So this is the drape where I'm going to place all my sterile supplies. So I want to make sure that I'm grabbing an edge, not the middle. So if I look at my drape, I can clearly see that my edge is on this side. So what I'm going to do is I'm just going to reach in and grab it. Remember, I have that 1-inch border. So if I'm grabbing the edge, I have an inch that I can touch. So that's what I'm going to do. I'm just going to pinch it up because what I don't want to do is touch the inside of this container. So I'm going to touch it in my 1 inch, grab it up, and I'm going to lift it up and step back. I don't want this to touch anything. Okay. So I'm going to step back and I'm just touching my 1-inch border and kind of letting it fall and open up. And just working its way around to letting it open up. When I put my drape down, you can see it's long and I want more room on my table, and I necessarily don't need a sterile field that's this large. So I'm going to place it on my table to where I just have a short area to work with. So I'm placing it like this. I want the shiny side, if there is one, towards me. And then I want to start by placing the drape away from me. I want to make sure that everything on my table is out of the way, so where I can place my drape properly. Okay. So I'm going to start with it away from me and towards me. Now, anything that's hanging over the table here, this isn't sterile. I have a new 1-inch border when that happened. So now this is my 1-inch border here that's on the table, which I'm completely fine with. This is plenty enough area for me to work and do what I need to do. The next thing I'm going to do is I'm going to go ahead and grab my sterile tray. And this is where all my supplies are. Now, I'm going to go ahead and dump everything onto my field very carefully. So a couple of things might happen. So we do have some round things. So we do have some normal saline that's round, and we have tape that's round. So if something goes outside of your border, then just don't use it. You're going to pick that up and remove it without touching anything else that's sterile, including your drape. So for example, my tape here, it's in my 1-inch border, so I'm not going to use that. And I can easily pick that up from the top without contaminating anything else and set it to the side. So I just can't use that on my sterile field. The other thing that you'll notice is my measuring guide still remains inside of my tray, and that's completely fine. I'm going to put my sterile gloves on before I pour my solution, and so it's not a big deal that it stayed in there. So I can remove that when I put my sterile gloves on. So I'm going to set this to the side. The next thing I'm going to do is I'm going to go ahead and add all the extra things that I mentioned I brought. So first is my syringe. This is what I'm going to use for irrigation. So I'm opening it and laying it on my field without touching. The same with my extra cotton swabs. I'm just opening them and gently laying them on my field. And then I have those extra 4x4s. Again, opening and letting them fall onto my field. Okay. And then at this point, what I can do is just double check that I've got everything I need. And my sterile field set up. I want to make sure my table is in a nice, good location. I'm going to put my tray here with my extra solution. So as I mentioned, I may not use this extra solution. I may just use the one in my kit, but I do have it there just in case I need it. And then I've got my sterile gloves. So this area down here, if you can see, this is the area where I'm going to put my sterile gloves on. And that's why I wanted my drape positioned to the shorter way, so that I had extra room for the things that I needed that either weren't sterile or where I needed to prepare at. Okay, so this is where I'm going to place my sterile gloves on that. All right, so put your table where you want it. I'm going to go ahead and remove my sterile gloves. I'm going to use this drape for all my irrigation fluid, as well as any of my soiled items that I may need, because then I can always take that and put that in my red container when I'm done. I also do not have the ability to wash my hands or use hand foam without leaving my sterile field. I did do hand hygiene when I entered the room, so at this point it's not necessary for me to attempt or try to do hand hygiene again. So I am going to go ahead and just place on my sterile gloves. Try to make it to where you can see here. All right, so I'm going to open these. I'm just going to be nice and easy with them. I've got plenty of room here to place them on. These gloves are nice. They tell you where the thumb is. So I'm going to put my dominant hand on first. So open my little flaps. And do my tinting like we learned in sterile gloving. And then I'm going to go ahead and grab my dominant hand. I'm going to grab the glove with my non-dominant hand, the cuff. So just the cuff. And when I grab it, I'm just going to step back and I'm going to open the little cuff up so that I can get my hand in there. Remember, that cuff's no longer sterile. And I'm just going to keep my hand above my waist as I'm putting my glove on. Just watching, making sure my fingers don't touch anything non-sterile. These gloves do rip, so just be careful. Right, and then I like to go ahead and hold my sterile glove package in my 1-inch border and kind of grab and move this glove. My goal is to get this glove, the cuff of it, down on those 4 fingers as easy as possible or as much as possible. I can touch this glove anywhere with this hand. They're both sterile. Okay, I'm going to leave this package here as well because I can also put any of my extra things that are dirty on this surface as well. So I've got my glove down on my hand as far as I can get it, and then spreading my fingers. And then once this hand, this non-sterile hand, no glove, goes towards the sterile glove, the cuff is non-sterile. So that thumb here, this thumb needs to be up. Otherwise, you've contaminated So my thumb is up. This hand is going in the glove. And I'm just putting that on, keeping it above my waist. Okay, now my hands are sterile. The first thing I'm going to do is I'm going to go ahead and grab this out. This is my little measure, and I'm going to throw that on my field since that it didn't come out initially. So I'm touching the inside of this. My hands are sterile. This is sterile. I'm going to go ahead and grab my solution. So this solution was in my kit, and so the outside of it is sterile. So I'm going to take the lid off, and I'm going to lay the lid here without touching anything. And there's a little seal that I'm going to pull off. And again, I'm just going to lay that there. And then I'm just going to go ahead and pour my solution. I'm going to pour it all in this smaller side so that it kind of is pushed up, and I can withdraw it with my syringe when I go to irrigate. So I'm done with this. Just set that to the side. Next, I'm going to go ahead and grab my irrigation syringe and set it here where I can reach it. And I'm going to go ahead at this point and kind of move my stuff around. I'm going to need some 4x4s after I irrigate the wound in order to dry it. And I don't want to be rumbling through or messing with all my supplies. So I'm just going to kind of sit everything that I need. What I like to do is put my wound measure guide down and then kind of put some stuff on top of it that I'm going to need before I use that. So those extra 4x4s is generally what I'm going to use to dry around my wound surface after irrigation. I've got my syringe and my 2x2s. This also does have the red bag in it. So I'm going to use this at the end. So again, I'm just going to set it over here. I've got something to write my name, date, and time. Afterwards, again, I'm going to set that to the side. I don't need that until I'm non-sterile. So I have the roll. So this is the same thing that the wound was originally packed with. So in my mind, I know this is probably what I'm going to pack my wound with again. There are some extra 4x4s. There's the large pad, the ABD pad that we're going to use to cover the wound. And then we do still have some tape on there. So I'm only moving my table so that you guys can see. You do not have to move your table. All right, so I'm going to go ahead and grab my syringe, and I'm going to pull up solution. So as I mentioned, I know that I don't need a lot of irrigation solution for my particular patient. And what I'm doing is I'm just taking this, and as I'm pushing it, I'm going back and forth across the wound from dirty to clean, so from top to bottom for me. And what I'm doing is I'm waiting for the fluid that runs down to be clear. And so I'm going to do another 20. And I really don't have a lot of drainage, so it's pretty clear. And so that's plenty that I need. I'm going to go ahead and set that in my tray. And then, as I mentioned, I'm going to use these 4x4s in order to pat dry around the edges of the wound. So I've got a couple here. So start with the first one and kind of work my way around. Remember, we're not cleaning inside the wound with these, just around. And I'm just going to lay these on my drape there. And again, just working around. Okay. Right. And then the next thing I'm going to do is I'm going to grab my measuring guide as well as my Q-tips. So I'm going to measure. So stick that on there. And it is very thin plastic, so it really does adhere to the patient well, so you can really see. So I'm looking at length and width. So length from head to toes, width from side to side. So I'm going to measure that, and I can adjust this however I need to, right? So if I'm measuring it this way, then I can see this is about 3 inches wide, and then about 4.5 at the longest point long. And then I'm going to go ahead and take my Q-tips, and I I can see that I have an area here. So I'm going to go ahead and stick it in, and I have a little bit of tunneling. And when I stick it in, I'm going to kind of pay attention to where it goes to, and then I'm going to measure that tunneling with this. So I'm going to lay my Q-tip kind of here, and I can see that it's about 2 inches of tunneling. And I'm going to make note of where that location is. So 12 is the head, 6 are the toes. So it's a clock. So I'm going to say that we have, so 12, 7 o'clock, right? So at 7 o'clock, we have a 2-inch tunnel. And then I want to use a new Q-tip for each area because I don't want to put something from one side of the wound to the other. I know that sounds weird, but we also don't want to contaminate other parts of the wound. So I'm going to go ahead and take my Q-tip and feel around, and I can tell that I've got some undermining, which is where the wound tissue goes back and the edge of the surface skin goes over. So I'm going to do the same thing here, see how deep that undermining is and measure it. And it's a 1-inch undermining. And it's going to be at, so it's at 12, 11, 12, and 1 o'clock is where that undermining is. It's in all those areas. Okay. And then I'm just putting all that stuff onto my drape. Now at this point, I can go ahead and remove my sterile gloves. I can add any additional irrigation fluid to my tray if needed for my 4x4s. And then I'm going to put on a new pair of sterile gloves. Since I was kind of touching around on the surface of the wound, I'm going to put a new pair on before I start messing with those 4x4s that I'm going to, or the dressing that I'm going to pack into the wound. So go ahead and remove my gloves. Again, we're not going to do hand hygiene because I can't leave my sterile field still, right? So when I look, I see that I have plenty of solution remaining within my tray to be able to saturate my dressing appropriately. I am going to go ahead and move or dispose of the glove package with all the extra things I had. I'm not leaving my field. I'm just walking around. Okay. And at this point, I'm going to grab my sterile gloves and I'm going to go ahead and re-sterile glove. Same process, right? Grabbing the cuff, stepping back, keeping it above my waist, making sure my fingers don't touch anything. Then once that one's on, grab my paper, get that one down on my hand. Again, I'm going to leave my paper there, get my fingers open, thumb up, and above the waist as my hand goes in. Okay. All right. So now what I'm going to do is I'm going to go ahead and grab my my roll here. So this is like a roll of 4x4s basically. It's not 4x4s though. It's a long roll, but it's similar to that. And this is what I know that I'm going to pack my wound with. Okay. So I'm just going to saturate it here in my fluid that I use for irrigation. And once I get it saturated, I'm going to hold it over this larger container and just kind of wring it out, right? I don't want it completely saturated. It's more damp, right? And so once I get it that way, so I'm going to go ahead and grab the end of it. And I'm just going to lightly put it in the wound. And kind of pack it around. Depending on the size of your wound and tunneling, I may have needed to add extra cotton swabs in order to get the dressing in the tunneling or undermining better. I don't have deep tunneling or undermining, so I can lightly just put that in there with my sterile glove. I want this to be unrolled. I want it to cover all the surfaces of the wound. until it's packed to the top, but I do not want this to touch the healthy skin. So I'm just unrolling it with one hand and kind of holding it down in there with the other. Okay. And so getting it in there, making sure that I have enough. Now, I know our previous person had just this roll in there, but when I look and get this in there, I don't feel that I can cover all the surfaces of the wound with just this. I have an area over here that isn't covered. So I'm going to go ahead and grab my 4x4s. And then when I document, I'll say that I used the long dressing along with however many 4x4s I use. So again, I'm just putting it in my irrigation solution, bringing it out. Right now I've just got one. I think one will do. So I'm just going to kind of lay it over the top here and put it in that little area that's not covered. That looks perfect. Okay. All right, and again, just making sure that nothing's touching the healthy tissue around the wound. Now, the next thing I'm going to do is I'm going to grab my large pad. We call it an ABD pad. And I'm going to place this over that damp area. And then I did have a roll of tape that stayed on the field that I could use if necessary in order to tape this. At this point, my hands, they aren't sterile anymore. So if I wanted to get my tape, I could do so. I'm going to go ahead and use the tape that I have here, and I'm just going to do a quick and very light tape at the top and the bottom of the dressing. And then I'm going to go ahead and remove my gloves. I don't need my sterile field anymore. I am going to go ahead and, I got some hand hygiene. I'm going to grab my tape out of my pocket. So I've got paper tape that I prefer to use on my patients, especially with a dressing. So then I can kind of just add a little tape here. You doing okay, Miss Hernandez? You did? You slept a little? Well, that is shocking. Okay, and then I am going to go ahead and use my sticker that I had and date, time, and initial, and I'm going to put that on the dressing so that everyone will know when it was changed. I will also document. I'm going to document any drainage that was on the old dressing that I took off, the number or the actual contents of the inside that I removed of, 4x4s, rolls of dressing, whatever it is that I removed. Then I'm going to document what I irrigated it with, how much fluid I irrigated it with. Then I'm going to document the size of the wound, so length, width, document any tunneling, undermining, and remember using my clock to document the location of those things. I also want to make sure I document the peri-wound area, so the area around the wound, if it looks healthy, how the wound tissue looks within the wound, if there's any areas of necrosis. And then I want to make sure that I document what I put back into the wound as far as dressing is concerned. If I put, multiple 4x4s, or if I put a long dressing, then again, I just need to make sure I document all that in the chart so that the next person knows when they remove the dressing what they're going to find. And then we're just going to get Miss Hernandez in a comfortable position. She says she feels good on her side. And then I'm just going to put back on some gloves, and I'm going to clean all this up. I'm going to put all my stuff in the red trash. And I think we're good, Miss Hernandez. Okay. Thank you so much for letting us watch.